Your healthcare provider has recommended a Leep procedure to help evaluate abnormal cells found on your Pap or colposcopy. Leep means Loop Electrosurgical Excision Procedure. It is a type of biopsy that removes a small amount of tissue from your cervix for examination. Most women are surprised to discover it's fairly simple and can be done as an outpatient. In general, no preparation, such as fasting or sedation, is needed. Before the procedure, let your healthcare provider know if you are pregnant or think you're pregnant, allergic or sensitive to any medications, latex, tape, iodine, and anesthesia, taking over-the-counter or prescribed medicines and herbal supplements, taking blood-thinning medicines, aspirin, or other medications that affect blood clotting. The procedure is done between your menstrual cycles to allow the best view of the cervix and takes only a few minutes. Just like the usual pelvic exam, your feet are placed in stirrups. Your cervix will be numbed with a local anesthetic. The Leep procedure removes the abnormal cells using a fine wire loop. Electric current is used to cut through the cervix without damage to other tissue. Sometimes a special paste is applied to your cervix to prevent bleeding. The tissue that is removed is sent to a pathologist who examines it and gives the results to your healthcare provider for review and discussion with you. Leep risks include heavy bleeding beyond a normal period, severe cramping, the possibility some abnormal tissue is not removed, scarring that may narrow your cervix, infection, and small increased risk of preterm labor and delivery with future pregnancies. The Leep procedure allows a close look at your cervical lesion. The greatest benefit of Leep is the removal of abnormal cells that could lead to cancer of the cervix. While cervical lesions can be monitored, rarely do they go away. Most physicians do not encourage a wait-and-see approach when moderate to severe abnormal cells are present. Not having the procedure could lead to cancer of the cervix. Generally, patients can resume normal activities and return to work either the day of or the day after the procedure. Mild cramps and a watery or slightly bloody discharge are normal. You may notice an odor, but it should not smell bad. Normally, the Leep procedure does not change the timing of your period, but bleeding may be heavier. Do not douche, use tampons, or have sex for at least 4 weeks after the procedure. Vaginal drainage varies from woman to woman. Flow should not be heavier than your normal period and may last up to 4 weeks. If you are feeling cramps or discomfort in your lower abdomen or belly, there are a few over-the-counter options that may provide relief. Unless you are allergic, you can take acetaminophen or ibuprofen as directed on the container's label or by your healthcare provider. A scab may form over the place where tissue was removed. It may be absorbed or you may pass it. Please contact your healthcare provider if you have heavy vaginal bleeding. In most cases, a follow-up visit is not needed. You will be notified when your next PAP is needed. As you can see, Leep is a quick outpatient procedure that can provide important information on abnormal cervical cells and assist your healthcare provider in giving you the best possible healthcare.